You've also written about the use of catheters. Is it necessary to have a catheter? What are the risks of catheters, and what should a patient keep in mind when using one?
Well, if we start with the risk, we know that these are one of the definite facts that have been shown that for every day that you have a catheter in, you increase your chance of getting a urinary tract infection by about 7%. So you can see if someone has a catheter in 10 days, they got about a 70% chance of getting a urinary tract infection. What happens often with catheters, they're in either for convenience and a person doesn't really need them. Now, clearly, if you've just had major surgery and you can't get out of bed, you do need a catheter. But what you or your loved one must say every day to your nurse, do I need this catheter? Because we know that the main reason people have a catheter in longer than they need it is the simple fact that someone forgot to write on the chart, please remove the catheter. Nurses can take the catheter out. Physicians' assistants can. The doc has to write an order so they can get it. This is a simple thing that when your doc makes rounds or your nurse, you say, please ask my doctor if I need to have this catheter and have them write to remove it. So it's a simple thing that you can do and to make sure that you don't get a urinary tract infection because it's definitely one of the infections that are preventable.